Have an abnormal pap smear, and that's why you were referred to me. The pap smear is usually done as a screening test for cervical cancer. So for diagnosis, the next step is to do something called colposcopy. And I told you, you need colposcopy. And here you are freaking out about colposcopy. So let's talk about what is colposcopy. I know it's a big name, but all it means, remember, it has scopies, a scope in there. That means we look at your cervix through a microscope. So what is the cervix? Here is my diagram. You may or may not understand, but here you go. This is the uterus, and cervix is this lower portion of your uterus. So we look at your cervix through the microscope, which comes in through the vagina. So when we look at it, so this is the outer part of the cervix. This is the inner opening. So what happens, the cells which line the outer part, they are like our skin cells. We call them squamous epithelium. The cells which line the inside of the cervix are called glandular cells. They are glands. So these glandular cells, they come from the uterus and start going down. So there's a transition between the squamous cells, which are on the outside, and the glandular cells, which are inside. And that transition is called transformation zone. This is the transformation zone. And this is what we are looking at when we are doing a colposcopy. Because anything which goes abnormal, especially like a cervical cancer, grows in this area. So now this area I cannot see with my eyes. So what I use is an instrument called colposcope. This is a colposcope. Basically it's a microscope. You can see that it has got eyepieces which we can adjust it depending upon our eyesight. This is for magnification, and you come in. I'm gonna do like a pelvic exam. The speculum is in you, and this gets focused on the cervix. So now once this gets focused, we use some chemicals. This is called acetic acid. We apply this acetic acid onto the cervix. So what it's going to do, it's going to convert the abnormal cells into white cells. It looks bright white, which helps me look through this. Now remember this is magnifying it for me. 30 to 40 times my eyes can see. With that and this chemical is going to show me abnormal area. We also use another chemical called Lugol's iodine. It's like a dark brown. And what it does is that the normal cells, they are dark brown, but the abnormal cells, they are like a yellowy or very, very light brown. So it also helps me find out the abnormal areas. So once I see the abnormal areas, we're gonna have to make sure what kind of abnormality do you have. So we do a biopsy. Now don't worry about the word biopsy. It's a very microscopic biopsy. So this is the instrument. This is the biopsy instrument. See, it has got these two jaws in there, and it's just gonna go and pinch a little bit of your cervix and come out. It's a little pinch, tiny, tiny microscopic biopsy. This is what we use for it. So once the biopsy is done, you're gonna have some bleeding, just a little bit spotting and bleeding. So there's a medication we use called Moncel. It kind of looks like mustard, doesn't it? Yeah. So we apply this on the cervix, and this is going to stop the bleeding. This will later come out as a dark brown, like a coffee ground, like a material. So if you see that, don't worry about it. It's because I use this Moncel on it. So all colposcopy is basically looking at your cervix through the colposcope or the microscope. What is it gonna do? It's gonna confirm whether do you have really an abnormal area. Because sometimes pap smear could be false positive or false negative, right? So it's gonna confirm if there's an abnormality. It's gonna show me how much of your cervix is involved. So how extensive that abnormality is. And when I take a biopsy, is going to tell me what is the grade of the abnormality, so we can plan treatment. So it is very important. So don't worry about a colposcopy. If you have an abnormal pap smear, make sure you get one.